Welcome back to our class, and I'm your teacher, Chana, your teacher for today. Always remember the Lord said, if any of you lack wisdom, let him ask of God. He giveth to all men liberally, and upbraideth not, and it shall be given him. James chapter 1 verse 5. Let's start! Good day everyone, welcome back to our class. In our lesson for today is all about the lesson number 6, ailments and proper care of the respiratory system. So for today, we will discuss some of the respiratory diseases, how to take care of our respiratory system while experiencing these diseases. So first, what are some respiratory diseases? Let's discuss one by one. First, we have colds. The common colds is the most common diseases, occurring 25 times more often than other diseases. It is primarily caused by a virus. Several types of viruses can cause colds. Inflammation of the mucous membranes of the nose leads to a runny nose or rhinitis. It is always present when you have a cold. So, colds are the most common respiratory diseases. It occurs 25 times on a human being, in an individual. So, it is caused by a virus. How does you protect yourself from colds? First, avoid contact with those who have colds. 2. Take a good care of your nose, throat, and eyes. And last, avoid getting chilled or wet in cold weather. Next disease is bronchitis. So bronchitis is an inflammation of the bronchi. It is caused by the spread of germs following a cold or some other diseases of the respiratory system. A person with bronchitis usually coughs a great deal. He is short of breath and may find it difficult to breathe. Drugs that expand the bronchial tubes can help treat this disease by loosening the mucus. Next, we have the influenza. Influenza is caused by a virus. Its symptoms are high fever, redness of the upper respiratory mucous membrane, severe backache, and pain in the extremities. Although its acute stage usually lasts only 1 to 5 days, good care is important to prevent complications such as the pneumonia. Okay, next we have the pneumonia. Pneumonia, acute infection of the lung causing it to fill up with mucus. This is a serious disease caused by a viral and bacterial infection in the bronchial tubes or in the lungs. Pneumonia usually comes on suddenly with a feeling of being chilled or an actual chill, fever, coughs, rapid breathing, pain in the chest, and blooding cough or mucus from the nose. Next, we have the diphtheria. This is an acute bacterial infection of the mucous membranes of the throat and the upper respiratory passages. It is characterized by the presence of a white, leathery, false membrane. It is most dangerous to children. At the onset, there is a fever, chilling feeling, pains in the back and limbs, general malaise, and sore throat. If treatment is not begun by the third day, the chances of recovery are greatly lessened. Next, we have the tonsillitis. This infection of the tonsil is acquired through inhalation or following the ingestion of contaminated foods or liquids. The tonsil will swell up and rapidly enlarge, becoming filled with pus. Symptoms are fever, headache, general malaise, sore throat, pain upon swallowing, and swelling, and soreness if the lymph nodes at the angle of the jaw. Next, we have the pharyngitis. This is a sore throat of inflammation of the pharynx caused by bacteria or viruses. It can make one quite ill with chills, fever, and difficulty in swallowing. Next, we have tuberculosis or TB. TB is a bacterial infection that is most often found in the lungs. It is easily spread to other people through the mucus or the sputum expelled when coughing or laughing. Tuberculosis is either latent or active. When we say latent, TB means that you have the TB causing bacteria in your body, but you cannot spread the disease to others. However, you can still develop active TB. Active TB means the infection is spreading in your body, and if your lungs are infected, you can spread the disease to others. So that is that tuberculosis. It is either latent or active. Next, we have the laryngitis. This is the inflammation of the larynx of voice box. Bad weather, excessive use of the voice, and breathing in of irritating dust or gases make one more likely to develop this disease. Next, we have the emphysema, permanent enlargement and destruction of the alveoli. The lungs lose their elasticity and expiration becomes an active process. Next, we have the asthma. It is a chronic disease that affects your airways. If you have asthma, the inside walls of your airways are inflamed or swollen. Last, we have the lung cancer. This is one of the most disabling of the respiratory system. It is included in the group collectivity referred to as COPD or chronic obstructive pulmonary disease. This cancer grows in and in between the alveoli and the bronchi where their growth blocks the flow of air. Smoking is the factor in this disease. Look at the picture of the healthy lungs and a smoker lungs. If you are a smoker of a cigarette, your lungs look like this, and if you are not, your lungs would be a healthy lungs. With these diseases, there are helpful practices to prevent respiratory diseases. First, have a proper eating habits. Second, maintaining proper hygiene. Third, take enough sleep and rest. Fourth, avoid crowded places. Fifth, protect yourself from dust and other forms of pollution. Sixth, have a yearly checkup. And lastly, have the necessary vaccine to protect yourself from certain diseases. And how do we take care of people with respiratory ailments? First, we have to give the right medicine at the right time. Next, place the patient in a well-ventilated and comfortable place. Third, prepare a well-balanced meal for the patient. Be sure he has fruits and vegetables. And lastly, be sure the patient uses clean beddings, clothes, and other things. So that's all for today. I hope you learned something about the ailments and how to take care of our respiratory system.
Thank you for listening. God bless. Bye.